Hello, good morning, everyone. Good afternoon, good evening, my wonderful fans. How are you? You're welcome to today's program. Africa, Asia, Europe. I'm saying good morning, good afternoon, depending on the area you're watching me from. Okay, depending on the area you're watching me from, you're welcome for today's program. Today is going to be a combination of questions, and then I'm going to be discussing. I'm going to be finishing the last topic that I discussed the last broadcast I did last weekend. I'm going to be finishing up today on diabetics and hair loss. So today we're going to be finishing the topic. Last weekend I discussed briefly online if insulin diabetes causes hair loss. So today I'm going to be finishing it, and then take time to answer some questions. So please indicate where you are watching me from. Indicate where you are watching me from. You're welcome for today's program, Living and Managing Diabetics. All right. Uh, indicate where you are watching me from. And when asking your question, please also include the location you are watching me from. So today we're going to be discussing diabetics and hair loss. Briefly, last week, I did touch about it, but it's briefly. It was a question being asked, but I didn't go into details to explain if diabetics causes hair loss. So today, I'm going to be finishing it on this video. You're welcome for today's program once more. It's glad to see you guys, and it's glad to read from you guys. I've been reading all the comments, all your questions. I do appreciate it. Keep it coming. Do not forget to share this page, invite your friends to join this community. We need to grow this community up. And do not forget to watch the videos. It is important to watch the videos till the end. Don't just watch the video 2 minutes and then you go. You got to be patient to watch the video to the end. At the beginning, if you're watching the beginning 1 or 2 minutes, those are intros. So for you to get the real juice, you have to be patient to watch it towards the end. That is where you see or you gain more insight what I'm talking about. So try to make sure you guys watch the videos till the end. It is very, very important you watch the videos from the beginning to the middle and to the end to be able to comprehend very well what the question is all about. All right. So try as much as you can to watch the video very, very well. Today, Loki from South Africa, you are welcome. Loki from South Africa, you are welcome. All right, you're welcome. How are you? How is South Africa? And do you have any question for me before we go into today's program? Diabetics and hair loss. Diabetics and hair loss. Um, okay. All right. Does diabetes causes hair loss? You could see from the ticker what is going. You see from the ticker, there's a question rolling from right to left. It says, "Does diabetes causes hair loss?" Okay, that is the question. All right. And this is my answer. Okay. Does diabetes causes hair loss? That is the question. I'm going to put it in such a way. Let me change it the way you guys can understand it. Let me remove scroll. Okay. So hair loss can occur for a number of reasons, from iron deficiency and the stress of living with a chronic illness to even certain medication. Insulin resistance is symptom associated with diabetes. Okay, um, it's known to cause hair loss. In addition to losing more hair than usual, diabetes can also slow down hair growth. So the question I was asked before was, does diabetes causes hair loss? And that is the answer. When you are battling diabetics, remember that diabetes is a chronic illness. It's a long-term chronic illness. Anything that is chronic has no cure. All right? It's a long-term health issue. That is why it is called chronic. Sometimes you can control them. Sometimes you can assume that it cure them, but you might cure them for a certain period of time and it will suffer, it comes back again for the second time or come back again for the third time. So that is why it is called chronic. Once it is labeled chronic, okay, it means there is no definite cure for it. You might control it for a certain period of time, you might delay it, it might go and come back. So diabetics fall in the category of chronic illness. And the question is, does it causes hair loss? And the answer is yes. Okay, it causes hair loss. All right. Diabetes can affect all parts of your body. All right. It can affect all parts of your body. And that is why every time I keep emphasizing that once you have diabetes, remember you are battling your life. Okay. And then the choice you make, because it affects all parts of the body. There is no any part of your body that diabetes spares. It attacks anything that comes its way. That is what it is called diabetes. It is attack, attack, attack until you get to a certain period of time that the only way out is either death or you fight back. So it affects all parts of your body. And that is what we're going to be discussing on this video. And I've said this several times. Okay. We've said it several times in my numerous video, how diabetes affect your body. Okay. We've said it several times, how diabetes affect your body. Okay, if you have diabetes, your body doesn't, I've said it before, your body, okay, doesn't produce insulin, doesn't even use it effectively, or both. All right, and I did interpret it in a different way that you can understand. It's either your body is producing enough insulin, but your body doesn't know how to use it effectively to control the sugar level in your bloodstream, or your body is producing little, not enough insulin that your body needs to regulate the sugar content of your bloodstream. Okay, so the hormone insulin, okay, moves the sugar from the food you eat from your bloodstream into your cells. That is the essence of the insulin, because it doesn't want sugar build up in your bloodstreams. So the purpose of the insulin is to move the sugar from the food that you consume from your bloodstreams into the cells and store them, and then release them back when you need it, as in the form of energy. Okay, so where it can be stored or used in the later stage as energy. That is the essential duty of an insulin. It moves away the sugar from the food that you consume, okay, that is food that you eat, from your bloodstreams, and then store them into the cells of your body, and then release them back for you in the form of energy for you to use if you need it. So when the energy in your body is depleted, when the energy in your body is depleted or it's going low, okay, you are feeling weak or kind of dizziness, that you don't have enough energy, then your body is going to trigger that energy. Okay, that sugar that was stored in your cells to be released into the bloodstream to give you more energy. That is when you regain your energy. All of a sudden, you regain your energy because your body have now released those stored energy in your cells into the bloodstream. So the essence of the insulin is to move away the excess sugar that is in the bloodstream that you acquire from the food you eat into the cells of your body, and then store them there and to be used in the later stage, and then released back into your bloodstream in the form of energy. Okay? So when you don't have insulin, it is not used effectively, sugar can now build up in your bloodstream. That is when you become diabetes, because there's too much of sugar in your bloodstream. So this is how diabetes affect the body. So the excess sugar can damage the organs throughout your body, damage your nerves. Remember that you in our body we have thousands of nerves. Okay, we have thousands of nerves that are linking from one cells of the body to the other. So it destroys those organs, destroy those nerves in your body. That is when, if you don't treat your diabetes very well, it can cause you blindness, amputation, a lot of things, because those nerves connecting those eyesight are damaged. Okay, because of the excess sugar buildup in your bloodstreams. Okay, uh, so now we know the importance of blood vessels. We know the importance of blood vessels, and we don't want excess sugar to damage our blood vessels, because with the aid of blood vessels, the blood vessels carry oxygen. The oxygen that you need to breathe, it's carried through the blood vessels all over your body. So when your blood vessels are damaged due to excess sugar in your bloodstream, you have a problem. Okay, so your blood vessels carry oxygen around your body to nourish your organs and tissues. Damaged blood vessels may not be able to deliver enough oxygen to nourish your hair follicles. So remember, when you have damaged blood vessels, okay, then oxygen might not be transported to areas of the body where it is needed. And that is how it affects your hair follicles, because it is not nourished. The blood vessels are damaged. They are not getting adequate oxygen through the movement of blood, through the blood vessels to the root of the hair follicles. And when they are not being nourished very well, it affects your hair growth. Okay, this lack of oxygen can affect the normal hair growth cycle. And there are 4 stages. There are 4 stages of growing hair, and we're going to analyze them one by one today. Okay. Feel free to ask me any question while I'm discussing this. Okay. If you guys have any question, feel free to ask your questions. Okay. Feel free to ask your questions. All right. So I guess from my explanation now, you can understand how diabetics affects or causes hair loss. Okay. When you allow excess sugar level to build up in your bloodstream, because the insulin is not doing a job, it damages the nerves in your body, the organs in your body, the blood vessels. And we know the important role the blood vessels plays in our life. Through the aid of blood vessels, our body is able to move oxygen through the blood vessels to all over part of our body where it is needed. And those oxygen that are moved around all over our bodies nourishes the organs and nerves and blood vessels of our body. Where the blood vessels are damaged and the oxygen is not able to transport all over your body, they are not being nourished. Okay, the roots of your hair follicles are not being nourished. The organs of your body are not being nourished. The nerves in your body are being damaged. That is how it affects hair growth. So everything revolves around controlling your sugar level to make sure it doesn't go excess. Once your sugar level doesn't go excess, then you are in a good standing. Inam, you are welcome. You are welcome. Thank you very much. Watching from Pakistan. You are welcome. All right. So let's go back to what we were discussing before. Um, so now the second part of it is, how does diabetes affect the growth cycles of your hair? And as I said before, hair usually goes grow. Hair usually goes through 4 phases. Okay. Uh, let me uh, let me put it on. Let me put it up. Let me put it up so that my fans that cannot hear me can read what I'm talking about now. Let's. So how diabetes affects the hair growth cycle? As I said, there are usually hair usually goes through 4 phases. Hair usually goes through 4 phases. Okay, let me put it up. Hair usually goes through 4 phases. Okay, and we're going to go through them one after the other. So let me go back again to how diabetes affect the hair growth cycle. Okay, now, and I said hair usually goes through 4 phases. Okay, it goes through 4 phases. Now, for the benefit of doubt, you see the reason why somebody come online. Ruth, you are welcome. I'm good, Ruth. I'm good. I'm good. Long time. Long time no see. I'm fine. I hope you're doing okay. I hope you're doing okay. Thanks for asking. I'm doing okay. I'm doing okay. Okay, so for the benefit of you see this when I like you see what is shown on the screen here now, how diabetes affects the hair growth. I've explained it before. I've said it before in one of my videos. I have a couple of fans that are deaf. They can't hear. Okay, they can't hear and they can't speak. Some of them cannot speak. So when I'm talking, they can't hear and they are diabetic. So when I'm talking, they cannot hear me because they are deaf and some of them are dumb. So until I got an email from 2 of them that please, when I'm talking, I should say what I'm talking on the screen so they can read and understand and follow the program. So that is why you see I have to do I have to do 2 jobs at the same time. So before I come online, I have to write everything down, prepare it, okay, and then when I talk, those that can hear me can understand, and those that cannot hear me because of their situation can then read what I'm posting on. So that is why I'm pasting all those things online so that they can read and follow the program. Because if I'm talking, they cannot hear me because of they are deaf. They can't hear me. But when I put it online, at least they can read and understand what I'm talking about. So now we are going to be talking about how diabetics affect the hair growth cycle. And I said usually hair usually goes through 4 phases, and that is what we are going to be discussing now. Okay, hair usually goes through 4 phases. Okay, the active growing phase lasts for 2 years. The active Now I'm going into details how diabetics affect the hair growth. And we say it has four, it goes through 4 phases. Then the active years, the active growing phase lasts for 2 years or more. Okay, lasts for 2 years or more. I'm going to also put it down. Um, okay, let me see how I can make this happen. So I was saying before, hair usually goes through 4 phases. Okay, and the first one is okay. The active growing phase lasts for 2 years or more. During it, hairs grows 1 centimeter each month. After a transition period, hair then goes into resting phase. Okay? Okay. Now, the second and the third part. No, the third and the fourth part, because this is the first and the second part. Now, the third and the fourth part, what happened is um, now, then this is the last part. This last, remember, let me go back. Okay. The active growing phase lasts for 2 years or more. During it, hair grows 1 centimeter each month. Okay, then after a transition period, hair then goes into resting phase. Then what happened after it goes into resting phase is that the resting phase lasts up to 4 months. After this phase, some resting hair falls out. Okay, so you have to understand from this beginning, hair usually goes through 4 phases. And then the first and second phase is this. The active growing phase lasts for 2 years or more. During it, hair grows 1 centimeter each month. After the transition period, hair then goes into resting period. This is the first phase and the second phase. Then on the resting phase, it lasted for 4 months. So its resting phase lasts for 4 months. That is the third phase. Then after the 4 months, after that 4 months, which is the third phase, some resting hair falls out. Okay. Uh, somebody's okay. Good. Okay. So diabetes can interrupt this process. So what happened? This is when diabetes come into now. Remember, I say the normal hair growth goes into 4 phases. Every human being from your childhood, from the day you are conceived, from the day you are born, up to your adulthood, hair usually goes into 4 phases. The 4 phases that the first 2 years or more is the active years that your hair grows 1 centimeter each month. Then after a transition period, hair then goes into a resting phase. That is the second phase. Then this second phase, that resting phase now lasts for 4 months. That's the third phase. Now, after resting for 4 months, that's resting for 4 months, some hair starts falling out. That is the fourth phase. So anything that disturbs any of these 4 phases will cause you to have hair loss. And that is where diabetes kicks in to interfere in these 4 phases. So diabetes chooses its spots within these 4 phases to interfere. So when one of these 4 phases is interfered into, it's going to cause you to lose hair. So diabetes can interrupt this process. Anything that can interrupt this process is going to affect you to have a hair loss, slowing down the hair growth. So having diabetes can also cause you to lose more hair than usual. So anything that disturbs these 4 phases that you have to go through in order to have an adequate normal growth of hair is going to cause you to have either a slow hair growth, or at all you're going to have inadequate hair growth. So diabetes try to choose a spot within these 4 phases to attack. And when it attacks and succeeds, it's going to cause you to have a hair loss. And that is why the essence of diabetes is to attack every part of your organs, every part of your cells, and every part of your blood vessels and nerves. And that is why every doctor is going to keep nagging, shouting, control your sugar level. Because when you have excess sugar level in your bloodstream, you are inviting other complications that might worsen your health issue. So the best way to keep other complications arising, this hair loss, is to make sure you have adequate, make sure your blood, your sugar levels in the blood is normal at all times. So anything that is going to make you to have a hair loss or disturb these four phases, you have to mitigate against it. Try to control those things. So diabetes chooses any of these four phases to attack. And once any of these four phases attack, it's going to cause you to have hair loss. All right. So let me put it for my fans to understand what I'm talking about. Okay. Anybody has any question to go ahead and ask me. If you have any question, feel free to ask me. I'm waiting for other questions. Okay. While we're discussing, if you have any question, feel free to ask. I'm getting it. Let me see here. I'm waiting for any question so that I can. When the hair not regrows, it does so at so the usual rate. Okay. So, uh, where am I? Let me. So, diabetes can interrupt this process, slowing down hair growth. Having diabetes can also cause you to lose more hair than usual. And then let's go to the next one. Okay, let's go to the next one. That hair loss doesn't only affect your head. You can also lose hairs on your arms, legs, and other parts. Okay, when the hair regrows, it does so at a slower than usual rate. So not only that are you losing hair in your head, it's all over your body. So it is not necessary that you're losing hair only on your head. It is all over your body because your hair follicles is all over your body. There are nerves, there are blood vessels, there are thousands of blood vessels that run through your body. There are nerves, okay, that goes through your body. So it does not only affect the hair in your head, but the hairs all over your body. So that even if your hair tries to regrow, it's slower than the usual rate. Okay. People with type 1 diabetes are more likely to have condition called alopecia areata. There's something we call alopecia areata. With alopecia areata, the immune system attack the hair follicles. Okay, leading to the loss of patches of hair and head and other parts of the body. So alopecia areata, okay, is what is it? It's the immune system attack the hair follicles. It's like your body attacking your own body. Okay, so people with type 1 diabetics are likely to have a condition called alopecia areata. Alopecia areata is an immune system that attacks the hair follicles. And once your hair follicles are attacked, the root of the hair follicles are attacked, it also causes a complication for you to have abnormal hair growth or some patches in your hair growth. So people with type 1 diabetes are more likely to have this condition called alopecia areata, where the immune system attacks the hair follicles. And we know all the importance of hair follicles, the root of the hair follicle. It's like the root canals of your dental. Okay, if you want to destroy your teeth, like for instance, if any virus want to cause you to remove your teeth or have a toothache, it goes to the root canals. The root canals is where it attacks. Cause you have that excessive pain that you have to go and see a dentist to remove one of your teeth. It doesn't attack the crown of your teeth, it attacks the root canals. So the same thing goes to the hair follicles. The excess sugar doesn't attack the hair follicle, it goes to the root of the hair follicles to attack it so that you have an abnormal hair growth or some patches in your hair. All right. So other possible causes of hair loss includes the stress of living with chronic condition called diabetes. Okay, we're going to be talking about other possible. Let's talk about other possible causes of hair loss. All right. Let's discuss other possible causes of hair loss. One, uh, the stress of living with chronic condition like diabetes can cause you hair loss. I've explained the process why you have a hair loss through diabetes. Now, two, okay, let's talk about two, thyroid disease, which affects some people with diabetes, can also contribute to hair loss. I've told you guys about the importance of thyroid glands. So, if you're diabetic and doesn't have any thyroid issue, count yourself lucky because it's one of those areas that diabetes can attack your thyroid glands to cause you some complications. So if you have diabetes and doesn't have an issue of uh, uh, thyroid disease, count yourself lucky. For me, I'm unlucky on that because I removed one of my thyroid glands when diabetes attacked it. And we all know the importance of thyroid glands. They're called butterfly glands. There's two glands, one on the right, one on the left. Sometimes we refer them as butterfly glands. So thyroid disease, which affects some people with diabetes, can also contribute to hair loss. Okay, I don't want to go into discussing thyroid because thyroid is a separate topic itself. It plays an important role in our body. So that is why to maintain a good thyroid is very important. When you're having a thyroid issue, there is another complication that you have to deal with. So with thyroid disease, you stand a chance of losing hair if you have diabetes. So let's go to number three, possible cause. Number three possible cause is side effects of your diabetes medication. So side effects of your diabetes medication can also cause you to lose hair. So these are some of the other possible causes of hair loss. Your side effect of your medication can also cause you to have a hair loss. Thyroid disease, which can affect some people living with diabetes, can also cause you to have hair loss. And then the stress of living with chronic condition like diabetes can also cause you to have hair loss. Anything chronic can cause you to have hair loss. Like if somebody battling cancer, you know, they lose a lot of hair. So these are all chronic issues. The stress alone can cause you to have hair loss. We're not getting any question. We're not getting any question. We're not getting any question today. That's good. Uh, we all know the importance of diabetes management. I've said it how very important to manage your diabetes. Okay, it is important to manage your diabetes effectively by working with your doctor. You have to work with your doctor. It is very important you have a doctor managing your diabetes. Both of you have to work together. If you are truthful to your doctor and the doctor is listening to you, both of you have to work hand in hand to manage your diabetes. Especially you that is diabetic, you have to listen to your doctor at all times. Follow the guidelines, the directions, the treatment plan for you to attain to that goal. So you have to getting hold of your diabetes is managing it properly. And I've said it several times in my video. Diabetics have rules and regulations that you have to follow, and following those rules and regulations is going to do you more good than harm. Okay, so understanding how to manage your blood sugar levels at all times is very, very important. So let all of us learn how to manage our diabetes. It is very important to learn how to manage our diabetes at all times. Um, let's talk about tips of managing hair loss. Okay. Uh, I don't know if this is necessary. Let's wait for questions. Let's go into this now. If this is your first time to come across my page, you've not subscribed to my page, you are not following me, kindly do so. You can follow me on Facebook and on YouTube. Okay, the same name. Okay, you can go to any of these pages and then subscribe. It costs you nothing to subscribe, it costs you nothing to follow me. The importance of following this page is anytime I'm online or I post any new video, you'll be first to be notified. So if this is your first time coming across this page and you are not yet following this page, kindly do so. All right. If you're diabetics or you're a caregiver and you're looking for some information on how to deal with this chronic illness, then you are the right page. Follow this page so that anytime I'm live online, you'll be notified. And if there's any new content on diabetics, you'll be notified. So these are the benefit of joining this page. It costs you nothing to subscribe or to follow me. It's free subscription and free to exit at any time you are okay with it. All right. So kindly go to the page, YouTube page, or my Facebook page to follow. Thank you. Now let's talk about let's talk about please, I'm live online. I'm gonna call you. I'm gonna call you once I'm offline. Okay, I'm doing a live video. Once I'm offline, I'm gonna return your calls. All right, I'm gonna return your calls, or send me your question. Post your question online, and then I'm gonna respond. For those sending me a question on WhatsApp, I've seen your question, and I'm gonna respond once I'm off live video. All right, thank you guys very much. So let's talk briefly on tips for managing hair loss. Let's talk briefly on tips for managing hair loss. Let's talk briefly on tips for managing hair loss. Uh, there are some ways you can compensate for diabetes related hair loss. There are some ways you can compensate for diabetes related hair loss. And one way is medication. Okay. One way is medication. Okay. If alopecia areata is causing your hair loss, your doctor may also prescribe some steroid medication to reduce the inflammation in the areas of your hair follicles. So remember, I said alopecia areata causes the immune system to attack the hair follicles. So if that causes you to have hair loss, your doctor may prescribe some steroid medication to reduce those inflammation. Or you see a dermatologist or a skincare specialist may recommend a topical drug such as minoxidil or Regine to use. You rub it on your scalps and other areas of your body where you experience hair loss. So you can have, there are other, as I said, there are other ways you can compensate diabetes related hair loss. One way is through medication. So if that alopecia areata is causing you to have hair loss, the doctor may prescribe you some steroid medication that can reduce those inflammations, because those alopecia areata causes an inflammation, and due to that inflammation, it causes you to have that hair loss. So some doctors will recommend you some steroid medication to reduce the inflammations, or you can see a dermatologist or a skin specialist that may recommend you some topical drugs that you can rub on your scalp, uh, or in any area of your body that you're experiencing hair loss. Okay, those can also help. Okay, um, there are some pills that all over you can use to regrow your hair. Uh, but as I said, I'm against all the time self-medication. Living on self-medication without seeing a doctor is very dangerous. I do on the school of thought, I do advise everybody any self-medication that lasts more than 5 days, you have to stop and see a medical doctor for further investigation on why those symptoms keep reoccurring. It goes and come back. So you have to see your doctor to investigate further why those symptoms keep reoccurring. As I said, they don't treat symptoms, they treat the cause. Okay, so seeing a doctor would be very, very good advice to mitigate or compensate any diabetes related hair loss. So the most important thing is to control the inflammation, or to give you some uh, uh, ointment that you can rub in your scalps that's going to help you to regrow your hair or to reduce the hair loss. So one area is through medications. You can control your hair loss through medication, but that means you have to work with your doctor on that. Now, the second area, you guys heard about biotin. There's something we call biotin. Some of you might know what biotin is. People with diabetes may have lower than recommended biotin. If you have biotin, diabetes can also affect you to have lower than recommended biotin levels in your body. And we all know what biotin contains. Okay, biotin, let me put it here. So, number two, way you can compensate diabetes related hair loss is either through medication, or the number two is biotin. Biotin. Okay, people that lives with diabetes may have lower than recommended levels of biotin. Okay, uh, now biotin, also known as vitamin B7 or vitamin H, is naturally found in food such as, we're going to list those food now. So biotin is known as vitamin B7 or vitamin H, and it is naturally found in the food such as, we're going to list those food now. Okay. I don't know how I'm going to put it now. I'm waiting for questions to come in. All right. So biotin, also known as vitamin B7 or vitamin H, is naturally found in foods such as peanuts, B, almond, C, sweet potato. Okay, peanut, almond, sweet potato, onions, eggs, and oats. Onions, eggs, and oats. So if you have diabetes, there's a possibility you might have lower than recommended biotin. And when you have lower level of biotin, that can also help to cause you hair loss. So to compensate diabetes related friendly hair loss, you have to increase your biotin level. Okay, so eating these foods, okay, can help you to have a normal recommended level of biotin that can help you to regrow your hair. So peanuts, almonds, sweet potato, onions, eggs, and oats. These are food that can help you to increase the normal level of your biotin. There are some evidence that biotin supplementation may slow hair loss in people with biotin deficiency. So when you have biotin deficiency, there's the possibility supplementing with biotin may also reduce hair loss in people living with diabetes. So talking with your doctor before trying biotin supplement is going to be advisable. So before using biotin, try as much as you can to discuss that with your doctor, because there's evidence that biotin supplement may also help to slow hair loss in people that have biotin deficiency and living with diabetes. So before trying biotin supplementation, try to talk with your doctor. The recommended adequate intake of adult is 25 to 30 micrograms of per day. But supplement typically contain much higher amount. So ask your doctor for recommendation and advice. Okay? Ask your doctor for recommendation and advice. For the benefit of my fans, let me put it up here. Okay. So the recommended adequate intake for adult is 25 to 35 micrograms per day. But supplement typically contain much higher amounts. So ask your doctor for amount that is safe for you to take biotin. So talk to your doctor before trying biotin supplements. Okay, it is very, very important. Okay, it is very, very important you discuss this medication with your doctor. Now, I'm going to have about 10 minutes more to go. All right. So, I'm still on the topic of tips for managing hair loss. The next one is exercise. Okay, daily exercise can help manage your blood sugar levels. We all know the importance of exercise and being physically fit, physically active. It's a great way to bring down your blood sugar and encourage oxygen delivery to your body, extremities, including your scalp. When you exercise, it opens up all the arteries of your body for easy blood flow, easy transportation of oxygen all over your body, all part of the blood vessels, nerves, and organs being nourished very well. So great exercise is very, very important. We've discussed it several times, the importance of having adequate exercise. Walking is very, very important. It's part and essential exercise method. Walking alone, walk 1 kilometer, half a kilometer, 1 kilometer, 2 kilometer. Those are very, very important exercise model. Swimming, weightlifting, okay, yoga, these are form of exercise that can help you keep a normal blood sugar level at all times. Everything revolves about controlling your sugar level at all times. When you have adequate control of your sugar level, you are avoiding other complications. So it is important to check your blood sugar level before and after exercise to ensure it does not get too high or too low. Avoiding dehydration is very, very crucial. Avoiding dehydration is very, very crucial. Uh, Now, I'm going to go to the final part. Um, Losing your hair can be very difficult for people living with diabetes, but you have an options. The option is at your fingertips. Speak with your doctor to learn more about what to do to manage your hair loss. They may be recommending adjusting your diabetes care plan, taking hair loss medication or supplement, or managing any related condition like thyroid disease and stress. Any symptom that occurs while managing your diabetes should be adequately discussed with your doctor. It could be your medication. Maybe they have to tweak it or change it or reduce the dosage, or and do other further examinations to find out why you are losing hair very fast. So that is why it is very important that you have to have a communication between you and your doctor, and both of you have to be frank and honest with your doctor and follow your doctor's instructions at all times and the treatment guidelines. It is very, very important. You have to listen to your doctor in managing your diabetes. So, friends, this is where I have to stop for this topic, diabetes and hair loss. If you have any further questions after this broadcast, you can send it to me. Uh, Leave a comment, send in your messages, your question in messages, and I'm going to respond at my own time that is convenient. Okay? So if you are living with diabetes, it is not hope lost. There is still more hope for you to live a normal life. It's all about following the directions of your doctor. It's all about following the rules and regulations governing diabetics. It's all about avoiding those things they ask you to avoid. And then you can now mitigate those complications that may arise from too much sugar in your bloodstream. So do not lose hope if you have diabetes or you're a caregiver or you have a loved one that is suffering from diabetics. As long as you understand the tips, as you understand the guidelines, it is very, very normal for you to live a normal life. Okay? Very, very normal for you to live a normal life. So the most important thing is living a normal life and then taking control of your diabetes. And once you take control of your diabetes, other things fall in place. Okay? So in the absence of any further questions, then I'm going to wait to see if there are other questions that are going to come. So if you have any other question, feel free to send me your question, and then we can now talk about it. So the floor is open to ask your questions. The floor is now open for you to ask your questions on this topic or any topic in general, and then we can trash it out. All right. So I'm going to wait for questions. I'm going to wait for questions. Let's wait for questions. I have questions on my phone here. People sending me questions on my WhatsApp. Sending me questions. Let me see what somebody asked me a question here. Let's see. Do I always work and start shaking, sweating, so that my body is a different sort of model. I have questions. Those are sending me questions on WhatsApp. I'm going to answer them later. And those are sending me questions. I'm going to answer those. I acknowledge I saw your questions, and those that are asking me private questions on my WhatsApp. I know when it's, and I'm not going to discuss it here because any question being asked on my WhatsApp is private. So I'll keep it private. I will respect your privacy, and I'm going to respond back to you. So I saw all your questions, and I'm going to respond back to you very, very well. Okay, I'm going to respond back to you to your questions. Those are sending me questions. Any question sent to me on my WhatsApp is I deem it private because not everybody uh, will be shy enough to ask a private question in a public forum. So those that are sending me question on WhatsApp, I consider it private, and then I'll respect the privacy of that person not to discuss it in public. So I got all your questions, and I'm going to answer those questions when I'm off live video. Other questions that are not private, I might answer it, or I'm going to just respond back the way the question was sent to me. And yeah, so I'm going to respond back to that later on. But I do appreciate your questions on my WhatsApp. I do appreciate very well, and then I'm going to deal with it once I'm off live video. Okay, so that is understandable. Okay, so do we have any other question? If not any other question, then this is 1 hour, and I'm going to say enjoy your weekend, and I'm going to see you guys. Keep the question coming, keep the comment coming, keep sharing, and please do watch the video till the end. When you start watching the video from the beginning, be patient to watch it to the end, and then that is how you understand the video very well, the topic very well. Don't just watch 2, 3, 5 minutes and then you go. Make time, watch the videos from the beginning to the end. I do appreciate it. Please make sure you watch all those videos from the beginning to the end to understand. Okay, it very well. All those videos that I'm posting, that is why I'm making those videos shorter. Watch most of the video I'm posting now, I make it 10, 15 minutes so that at least you're not going to waste too much of your data watching it. Okay, so try to make sure you watch those videos, even if it is 30 minutes, at least watch it till the end. So, friends, I'm going to allow you guys to enjoy your Saturday weekend. I'm going to see you guys some other time, and I'm going to respond to any of your questions. And then, thank you for bringing me into your home this Saturday. And then I'm going to see you guys in my next video some other time coming. Stay blessed, and then goodbye to all of you. Bye bye.